stop for a second. Okay, so we've cleaned up the foot and you can see the bunion's gone. We're going to have a nice result. Now I'm going to put some white knobs on the ends of the wire so that they're not likely to dig into the skin and bother our lovely patient here. Going like this. Okay, now I'm going to put a non-stick dressing on so it doesn't stick to the sutures or stitches. Betadine. And a little bit more over here. Okay, a little down here. A little up here. Good. Okay, vinegar. I'm going to put some gauze around the wire to avoid pressure on the wire. Now we're going to wrap everything up with some rolled gauze. And I'm going to put a 3x3 by the 5th metatarsal head to protect it. And I'll put a few extras here for a little compression. And I'm going to adduct the toe. I'm going to make it a little excessively straight. We call this overcorrection while the foot is taped. Okay. Inch tape. I'm going to use some 1-inch hypoallergenic tape just to hold everything together. It doesn't have to be tight. plantar flexing slightly and adducting the great toe. There's the Aiken osteotomy. You can see how it's going to make it straighter, and stay with me. And here's the Wilson osteotomy. You can see the bump's been removed. The head has been shifted over. There is a small ossicle that was present before surgery. We're leaving it alone. That's the dorsal view. And let's go this way a little bit. There, you can see the osteotomy. This is a lateral view. There's the proximal phalanx. And you can see the sesamoid. Perfect. This is called a dancer's pad. It's a 1/8 inch felt pad that I'm going to put on the bottom of the foot under the first metatarsal head to prevent excessive dorsiflectory pressure. In other words, we don't want it to get shoved dorsally or this way up too much. And now to make everything nice and neat, 3-inch tape, elastic tape. For people who are allergic, we don't use this. We use the hypoallergenic tape. And I'll just put a couple of band-aids on where I performed the anesthetic injections. Give me 3, please. Turn your hip a little. And that's it. Margaret, you were terrific, as usual.
Thank you.
You're welcome. Okay, we're going to now get a post-operative x-ray, and then we'll put a sandal on Margaret's foot and give her instructions, and she'll be all set to go. Good. Okay, we've taken an x-ray, we've developed it, it looks great. We'll look at it in a minute. We're putting on a stockinette to keep Margaret's foot nice and warm for the ride home, because this is Toronto and it's January. And then we use a surgical sandal. They only come in black. Goes with any outfit. Actually, it does go with your outfit.
Sandals only worn when I have to walk around the house. Otherwise,
well, yeah, you don't even at home. You don't have. If you feel more comfortable without it, you don't have to walk. But anytime you go outside, you should have it on.
Okay. Well, I don't think it was.
That was brilliant.
Thank you so much, Dr. Adele. That was wonderful.
Okay, let me let you down. Have we given you instructions yet?
Yes.
We've given you instructions. We gave you a prescription, or I just signed one for what is it, naproxen or something? Yeah. For naproxen. And you'll call me if you have any problems. You've got my cell phone number if you need me.
I do.
Okay.
Thank you very much.
You're welcome.
And I'll see you next Wednesday for the
Sounds
next
good.
checkup.
Beautiful. Okay.
Thank you.
You're welcome.
It was equally as bad, I believe, as the right foot prior to surgery, and you did that for me in just under 3 years from now. It'll be 3 years in March.
It's okay?
Absolutely okay. It's 100% okay.
Beautiful.
Perfect. No pain. And this one, in fact, the left one, I had constant throbbing all the time, 24/7 prior to surgery, and that immediately was gone.
Although we can't make any guarantees, and you can't assume everybody's foot will turn out that well, I'm very happy that it did.
And I followed your instructions, though, to the T, I must say.
Good. We like patients like you, Margaret.
Yeah, that's well. It's important. Your feet are important.
That's right.
You have to look after them.
Very good. Thank you.
There you go.
Okay, we'll see you guys next week.
Great.
You're welcome.
Take care.
Good.